Brad Williams, Frugal Finance. I'm going to talk about choosing Medigap policy, a guide to health insurance for people with Medicare. This is going to be a very, very long video, or I may break it down to 5 or 6 videos. It depends. It's 52 pages. With that, I'm going to get started here. The official document has important information about Medicare supplemental insurance, Medigap, what Medigap policies cover, your rights to buy a Medigap policy, and how to buy a Medigap policy. This is dated 2024. Ignore the date. The principles are still in place here. If there are any updates, I'll provide them. Important information about this guide. This information in this guide describes the Medicare program at the time this guide was printed. Changes may occur after printing, etc., etc. I'm going to cover all this information. As I said, it may be one very long video, or I may break it down into pieces. What's Medicare? Medicare basics, your rights to buy a Medigap policy, steps to buy a Medigap policy if you already have a Medigap policy, and a few other areas. This PDF, it'll be linked below. Medicare basics. What's Medicare? Medicare is a health insurance for people 65 or older. Certain people who are under 65 with disabilities and people of any age with end-stage disease or Lou Gehrig's disease will automatically qualify for Medicare. The different parts of Medicare help cover specific services. You have Part A, which is hospital insurance. It helps cover, and remember that, it helps cover. That's why there's this Medigap policy. It's going to fill in those gaps. Inpatient care in hospitals, skilled nursing facilities care, hospice care, home health care. Part B helps cover services from doctors and other healthcare providers. Outpatient care, home health care, durable medical equipment like wheelchair, walkers, hospital beds, and other equipment, and many preventative services like screening shots or vaccines and yearly wellness visits. Part D, drug coverage, helps cover costs of prescription drugs, including many recommended shots or vaccines. Plans that offer Medicare drug plans, Part B, are run by private insurance companies that follows rules set by Medicare. Your Medicare coverage options, when you first sign up for Medicare and during certain times of the year, you can choose how you get your Medicare coverage. There are 2 ways to get Medicare. Original Medicare includes Medicare Part A, hospital insurance, and Part B, medical insurance. You could join a separate Medicare plan to get Medicare drug coverage D. You can use any doctor or hospital that takes Medicare anywhere in the U.S. to help you pay your out-of-pocket costs in original Medicare, like your 20% coinsurance. You can also shop for and buy supplemental coverage. Part A, Part B, you can add Part D. You can also add supplemental coverage. This includes Medicare supplemental insurance, Medigap, or you can use coverage from former employer or union or Medicaid. Medicare Advantage, also known as Part C, a Medicare approval plan from a private company that offers an alternative to original Medicare for your health and drug coverage. These bundled plans include Part A, Part B, and usually Part D. In many cases, you can only use doctors who are in the plan's network. In many cases, you may need to get approval from your plan before it covers certain drugs or services. Plans may have lower or higher out-of-pocket costs than original Medicare, may also have an additional premium. Plans may offer some extra benefits that original Medicare doesn't cover, like certain vision, healthcare, and dental services. Part A, Part B, most plans include Part D and some extra benefits. Some plans also include lower out-of-pocket costs. Medicare and the health insurance marketplace, even if you have marketplace coverage or other individual health coverage that isn't based on current employment, you should generally sign up for Medicare when you're first eligible to avoid the risk of delay in Medicare coverage and the possibility of Medicare late enrollment penalty. You can keep your marketplace plan without penalty until your Medicare coverage starts. Once you're considered eligible for premium-free Part A or already have Part A with a premium, you won't qualify for help from the marketplace to pay your marketplace plan premiums or other medical costs. If you continue to get help paying for your marketplace plan premiums after that point, you may have to pay back some of or all of the help you get when you file your federal income taxes. Visit healthcare.gov to connect to the marketplace in your state and learn more. To find out how to end your marketplace plan when you become eligible for Medicare and avoid gap in coverage, visit healthcare.gov, Medicare changing from marketplace to Medicare. You can also call the Marketplace call center at 1-800 or use this other number. No, Medicare isn't part of the marketplace. The marketplace doesn't offer Medicare supplemental insurance, Medigap policies, Medicare Advantage plans, or Medicare drug coverage, Part D. Find more information about Medicare, you can check out these links right here. Comment if you have any questions so far about chapters 1 and 2. Brad Williams, Frugal Finance. Thanks for watching. Hope that helps. See you soon.